So today's topic is runner's knee, and this has to do with the patella, the kneecap, not tracking properly. And we're going to have to go through a whole number of different issues here, because it's not just about the knee, it's actually about the foot, the knee, the hip, the back, and this whole kinetic chain. We're going to have to work through some osseous structures, but also get on and do some pin and stretch and myofascial release, and then also consider some acupuncture points and some things that may actually keep runner's knee going over a period of time. There's some people who have had chronic knee problems for a long time. Certain factors they don't actually take into consideration. Okay, so let's actually work our way around a few different structures here. Mickey, you okay with me working on the leg here?
Yeah.
Let's start out with the quadriceps here. Mickey, I'm going to get you to bend your leg back here, grab this, and take it in there. Good. You okay?
Okay.
Now let's actually bring it to here. Take it right in. Good. That's not too bad, is it?
No, it's not bad at all.
Okay, so I wouldn't find much of a restriction here. So we have to consider multiple areas. And so if we're getting into our secondary hip flexors here, the quads, the primary being deep to the abdomen, iliacs, and psoas. You might want to see how those are. So I'm going to get you to actually lie back for a sec here. Come over the edge here a little bit. Good. I'm going to come here, bring this down, grab your leg. Good. Now drop it down here. You okay?
Oh, that's tight.
Yeah, feeling that one a bit more. Now, no, actually, just take it to here. Drop it again. Good. Up. Take it down. Pretty tight?
Yep.
Okay, so if there are tight hip flexors, that is going to affect quadricep activity, and that will affect the patellar tendon. Good. You okay?
Yep.
Good. And I will get you to bring your leg up here. And let's get on your adductors. Now, the muscles on the inside of the leg here are really important because besides just moving the leg out, they are the reciprocal muscle to the glutes. So in terms of hip function, just leg stability, if these muscles are tight and contracted, neurologically, they will dampen the glutes so you won't have as much strength through your primary hip extensors. You okay?
Yeah.
Not too bad?
No, I was waiting for
Okay.
it, but it's not bad.
Okay, so what I'm going to get you to do though, take a deep breath in, let it out slowly, breathe into your nose, tongue out of your mouth, take it down. Right down. So in all these moves, I'm actually going to get you to we'll just hold it a bit longer there. Doing okay?
Mm-hmm.
Back up. Take it down. Good. Not too bad then.
No.
Back up again. Take it down. Good. And down. Now, anytime we're working on the knee, we also consider we could have some indications from the glutes, the tension up here, and the IT band. So I'm just going to check and make sure that's going to be tight anyway. How you doing there?
Yeah, that's good.
Okay. Now what I want you to do, I'm going to take it to the side here. Deep breath in and release. Deep breath in and release. A little easier to take? Okay. Using your breath to help the release really helps, doesn't it?
Yeah.
Down. Good. So what we also have to consider are some of the connections between the pelvis. So how the SI joint is moving, how the hips are moving. Some of the osseous structures also in the foot. Mickey, it's okay if I just take a look and see how things
yeah.
are? Turn on your side towards me, actually. Okay, so. All right, so I can be moving a little bit better than it is right now. Bring this down here. So I'm just going to do a little bit of manipulation on the SI joint here. Take it right to the side, down. Good, perfect. Okay. Let's make sure we've got good hip mobility here. You're fine.
Yep.
No issues there whatsoever. And we'll also take a look down and just make sure. So whenever you're working on a structure, you have to consider the kinetic chain above and below. Yeah, that's not so much. A little navicular there. Good. No foot pain lately?
Nope.
Good.
No.
All right. So as an adjunct to this, let's move on to some acupuncture points. So in conjunction with the osseous adjusting and the soft tissue releases, myofascial release, we could also combine some acupuncture. Now, we can do acupressure. If acupuncture is within your scope of practice, then that will work very well, especially with electrical stimulation. But otherwise, we'll just get in and work our way around some really effective points here. I'm only going to show you a few points. We also have a complete fascial expansion for the knee in MSR, and these videos are available online or in courses that we're teaching. So in terms of one of the points I'll give you is stomach 34, and stomach 34 is on the anterior thigh, 2 chun or 2 thumb widths above the patella, in depression right on the rectus femoris muscle. Okay, so we're about 2 chun above there, but right there. Feel that one there?
Yeah, it's not bad.
Yeah, not bad?
No.
Okay, so I'm just gonna get in there, kind of work it out a bit. Don't feel that too much?
No, actually,
Good.
it's pretty good.
Okay, so I would get in there on stomach 34, and I would work this out for about a minute to 3 minutes. And this will really help to release all the structures around here. We really have to remember that when it comes to acupuncture points, it's a thickening in the extremities, about 90% of the fascia, and we have 10 times the neurological input in this area. Good. Now, if you want to go up and across here, just over a bit here, we're going to run into spleen 10. And this is also about 2 chun above the superior medial border of the patella. And this is more along the vas medialis. We'll come down here a little bit. Yeah, about there. You're feeling that one a lot more.
That one, yes.
Yeah. Okay, so we'll get in there. And so this is spleen 10. Some pretty common points that I'll actually release. Now, Mickey, I'm going to get you to please use your breath to help me release this. So slow breaths, breathing through the nose, tongue on the roof of your mouth, and just let it out slowly. Good. It's really the wildest thing. You'd be working on an area and you feel this thickening or restriction, and then you get the patient to start doing some respiratory release, and all of a sudden that area will just soften right up. There we go. Feeling that?
It's better now.
Yeah, quite a bit better. So while we're here, on the anterior lower leg, 1 chun lateral to the tibial crest here. So we got the fibula on the side here, and we're just going to come down to about right here. This one is spleen 36. Okay. Is that sensitive at all in there?
No, actually.
No, not too bad,
No,
eh?
it's fine.
So again, if we work on an area and you don't feel like it's actually restricted or thickened in the area, you don't have to work that area, but it is good to just determine whether or not this is a point that is influencing the myofascial restrictions around the knee. So these are just a few of the acupuncture points we would use in the area. Again, we treat this for 1 to 3 minutes. So one really important aspect of these protocols is mobility and strength. It's very, very important that you focus on this. Mobility exercises pretty much every day, strengthening every other day, but we're talking about working on the entire kinetic chain. Is this what you found in helping people with the runner's knee?
Oh, definitely. Actually, a really thing that I found worked so well was lacrosse ball.
Mm-hmm.
So using the lacrosse ball worked, I found, the best, but also when you start to incorporate it with breathing.
Yep.
So when you're breathing through, because sometimes when we start to put the lacrosse ball in areas that you know are going to be a little bit more painful, we hold our breath or we tend to breathe really fast. So really focus when you're using lacrosse ball in that quad area, especially when it hurts. Slow down your breathing, focus on diaphragmatic breathing versus those quick breaths. So quads are going to be something that you really want to focus on. And we actually do have quite a few videos.
We do, and I'll put links down below so we can do myofascial release plus strengthening videos.
Yes.
And just as a clinical pro, when you strengthen the abductors, legs coming out to the side here, all the muscles involved in that, in conjunction with ankle mobility. Those are probably two of the biggest things that are actually going to help you with this.
Most definitely.
It's huge, just huge.